Hello and welcome. It's 11 a.m. here in Seoul. I'm Kim Do-yeon at the Arirang News Center. We're breaking into our regular programming to bring you the latest live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Son Young-rae, a senior official at Central Disaster Management Headquarters, will be briefing us on the coronavirus situation here in the country. Now let's take a listen to the health authorities.
Moreover, we are joined by the department head from the Health Ministry, and we also have sign language available for you today. First of all, here is Mr. Son Young-rae, who will be briefing us on the COVID-19 response measures here in South Korea. Let us now begin our regular briefing for August 24th, Tuesday. Today, the health authorities have discussed measures to bolster quarantine measures at the public saunas. And after July, we have seen a total of 15 cluster infections related to these similar facilities, infecting more than 600 people. And we are seeing a rapid spread of the confirmed cases in these facilities. And as for the public saunas, most of the places have 3C conditions, meaning that they are confined and they have poor ventilation and they are also crowded. And also it is very difficult for the users to wear their face masks. And we believe that these areas are prone to high-risk infections. And to this end, the health authorities have discussed measures to bolster quarantine measures. And in order to also facilitate more people to wear the face masks at these facilities, we are going to ask all of the users to wear them, and we will also distribute about 6 million face masks to public saunas nationwide. And we are also recommending the users to wear their face masks, and also we are going to provide face masks for those who are having some inconveniences due to the face masks that become wet in these facilities. And to this end, we are also going to intensify our quarantine measures by having a regular ventilation system and policy for these areas. And we are also going to confine and prohibit the people there to consume food within these confined spaces. And going forward, we are going to have a regular PCR testing, as we are doing right now for the workers at these public saunas. And these intensified quarantine measures will be put in place starting from the 1st of September, and the government will make sure that they are abided by on a regular basis, and we are also going to discuss related matters going forward. And together with the members of the related industries, we are going to make sure that they are improved going forward. And as of today midnight, we have a total of 1,470 new local infections and 39 new imported cases. We had 6 additional fatalities, and I extend my deepest condolences to the deceased and the members of the bereaved families. And as of today at midnight, we have out of some 800 hospital beds for the ICU care units. We have about 250 beds available for immediate use, and about 2,000 COVID-19 designated hospital beds are available nationwide. And also at residential treatment centers, we have more than 8,000 hospital beds available for immediate use. And we are currently witnessing an increase in the daily infections, and we are also seeing an increased burden in the amount of the medical response capacity. And to this end, we are making sure to secure more hospital beds going forward. And as of yesterday, we have seen that in the metropolitan area, 180 hospital beds and a total of 250 beds across the nation have been secured as for the COVID-19 designated hospitals. And also, we have secured more hospital beds for the ICU units. And going forward, by this weekend, we are going to increase the number of available hospital beds that are going to treat COVID-19 patients. And as of yesterday, we also have 381,000 more people receiving their first dose of the COVID-19 vaccine. And about 714,000 people received their second dose, and more than 1 million people received their COVID-19 vaccine dose as yesterday alone. And currently we have about 51.2% of the population receiving their first dose. And yesterday we also had the 1 million of the Moderna vaccines arriving here in the country. And also during the next 2 weeks, we have in schedule to have about 6 million more doses to arrive. And going forward, we will also have more Pfizer vaccines arriving here in South Korea. And we believe that we are at a very sufficient amount of vaccine doses to supply and to inoculate about 70% of the total population with their at least first dose before Chuseok. And we believe that we can fully vaccinate about 50% of the entire population going forward. And if our vaccination rate increases to this threshold, we believe that we will have decreased risks of COVID-19 infection. And starting from this Friday, we will be rolling out our vaccinations to the age groups of 18 and 49. And if there are people in this age bracket who have not yet made their COVID-19 vaccine reservations, please do so going forward, as the vaccination reservation opens until the 18th of September. And as for the senior members of the society, if you have not yet gotten your COVID-19 vaccines, please also make sure that you get your COVID-19 vaccine by making your reservation, as well as this is also going to be open. And yesterday we also have the implementation of the extended social distancing measures, which will be in place for the next 2 weeks. And we believe that many people are experiencing psychological pain and discomfort, as well as great challenges due to such prolonged antivirus restrictions. However, until the day when we have high level of vaccination rate here in South Korea, we need to continue to have a tough quarantine measures here in South Korea. And we also have some messages for the foreign workers here in South Korea. And centering around the foreign community here in South Korea, we are also witnessing an increased number of infections. And we believe that the PCR testing is very important for us to trace the COVID-19 patients at an early stage. And regardless of your residential status here in South Korea, please note that you are eligible to get the PCR testing free of charge, and you will not also be notified. We will never notify your status to the immigration office. So if you have any clinical symptoms of COVID-19, please get tested as soon as possible. And we also ask you to refrain from travel and movement around the country. And we also would like to highlight the fact that you are also members of our society, and we would like to ask for your consideration and participation. And thanks to your efforts continuously to curb the COVID-19 virus, and also your participation in the social distancing measures, we are going to contain the virus spread, and the fourth wave will be contained going forward. If we have concerted efforts, we can overcome this fourth wave. And even at this moment, we would like to extend my deepest gratitude to all of you for your participation. And even at this moment, there are many people who are exerting their full efforts at the front lines of the COVID-19 fighting against the COVID-19 virus. And we thank you once again. And the central government will also make sure to exert our full efforts. Thank you very much.
That was the government briefing on the COVID-19 situation here in the country. To wrap things up, South Korea reported 1,509 new cases of COVID-19 on Tuesday, of which all but 39 were locally transmitted. The number is still impacted by the slow testing over the weekend, but comparing to last Tuesday, the first day out of a long weekend, it is 137 higher. So far, more than 12 million people have been fully vaccinated. For more, we'll be back at 12 p.m. Korea time with our midday news with Mark Broom. Bye for now.